In this video, I'm going to be going through Ebstein's anomaly. Ebstein's anomaly is a congenital heart condition where the tricuspid valve is set lower in the right side of the heart towards the apex of the heart, and this causes a bigger right atrium and a smaller right ventricle. This leads to poor flow from the right atrium to the right ventricle and therefore poor flow to the pulmonary vessels. Is often associated with a right to left shunt across the atria via an atrial septal defect. When this happens, blood bypasses the lungs and leads to cyanosis. Ebstein's anomaly can also be associated with Wolff-Parkinson-White syndrome. So how does it present? The typical presenting features include evidence of heart failure, for example, edema, a gallop rhythm heard on auscultation, cyanosis if there's an associated atrial septal defect, shortness of breath and tachypnea, which is a raised respiratory rate, poor feeding, and potentially collapse or cardiac arrest. Symptoms in patients who have an associated atrial septal defect often present a few days after birth when the ductus arteriosus closes. Where there's a right to left shunt across the atrial septal defect, the ductus arteriosus allows blood to flow from the aorta into the pulmonary vessels to get oxygenated, and this minimizes the cyanosis. However, when the duct closes, the patient then loses the benefit of having the ductus arteriosus, and the patient becomes cyanotic and symptomatic. Let's talk about investigations. There's a few ECG findings, and these may include arrhythmias, right atrial enlargement, right bundle branch block, and left axis deviation. Chest X-ray findings might include cardiomegaly and right atrial enlargement. And an echocardiogram is the investigation of choice for confirming the diagnosis and assessing the severity. Let's talk about management. The medical management involves treating arrhythmias and heart failure. Prophylactic antibiotics may be used to prevent infective endocarditis. The definitive management is by surgical correction of the underlying defect.